On April 22nd, the Biden administration finalized a rule that they say elevates the role of Medicaid members in helping to set Medicaid program and policies. It's called Ensuring Access to Medicaid Services Final Rule, and it makes changes to a number of things, some home and community-based services and payments to the direct care workforce. But it also makes sure that there is an elevated voice for Medicaid members. It includes major updates to Medicaid member engagement requirements for states, and it takes effect in May of 2025. Now, states already need to convene some sort of Medicaid member advisory committee, but there's not consistency across the states. Each state does a little bit differently, and the focus has largely been on health, not necessarily on coverage or eligibility. So the final rule changes that. First, it renames the state committees to Medicaid advisory committees, and it expands the scope of their purpose. It also requires states to create beneficiary advisory councils. It creates minimum requirements for Medicaid member representation on these committees, and it promotes transparency and accountability in the meetings and in the reporting. The feds say that some of the requirements of the new committees include a clear member selection process for who will be on these committees, standards for composition of the committees, including diversity considerations, requirements on meeting frequency and public access, and of course, some staffing and reporting requirements. In a statement, the Center for Medicare and Medicaid Services Administrator Chiquita Brooks-lasure said, CMS set its sights on an equally ambitious goal. Make sure that coverage connects people to consistently high quality care, regardless of where they live or receive care. And she said that goal is ambitious, but it certainly is obtainable. CMS says that these changes are going to expand the role that Medicaid members can play in shaping all elements of state Medicaid programs and policies. You can read that final rule. We link to it in the description below.